Headache and dizziness are one of those symptoms that we all experience at least once in our lifetimes. And then we have an appointment, we go to a doctor, and it brings us to actually nothing. No diagnosis and no cause identified. So what happens then is that the patients usually continue to suffer from dizziness and headache, and possibly additional signs and symptoms that might indicate that patients actually suffer from one of those conditions up here that could be possibly lethal and are definitely dangerous. We will explain what these conditions are, and then we will explain how to recognize them. But don't be easily confused. You probably noticed the word bleeding in these conditions. And one might think, well, it's probably easy to recognize, right? After all, the human brain is covered with veins and arteries. So how could one possibly not recognize a patient with intracranial bleeding? I mean, they probably just lose consciousness and die. Well, we shouldn't be that naive. Intracranial bleeding can develop over a prolonged period of time and cause subtle and general symptoms. Recognizing intracranial bleeding can truly save the patient's life, and because this video was optimized for the United States medical licensing exams, we try to state only evidence-based medical facts in this video, and we created this video using anatomsky.com. So if you're a medical professional or a doctor and you want to make a similar video, then you can use that website. Now, even though epidural hematoma might be easier to recognize, in order to show you where it is, I would have to put my head down like this and then slice open it, and eventually then you will be able to see something like this. What you can see here is the human skull after the brain was removed. This white lining here is called dura, and it covers the bone of the skull. It is the outer brain membrane. Now, if you look closely over here, you can see that the dura was removed, and we can see the middle meningeal artery. This artery can bleed and cause headache, but it's usually easy to recognize because it is often just a result of a fracture or an injury. It's also usually easy to notice when an artery ruptures on its own and bleeds. As you can see here, there are many arteries around the brain, and most of these arteries are in the so-called subarachnoid space. Now, if I were to slice open my skull frontally, you would be able to see something like this. And if I were to zoom in, then you would be able to see that there are layers outside of the brain. This over here is the subarachnoid space. And if I were to use colors to better illustrate this, you would be able to see first the skin, and then underneath the skin, the bone tissue. Right underneath the bone tissue is the dura we explained earlier, and then you can finally find the arachnoid mater. These two are basically the brain's membranes that protect the brain. And underneath the arachnoid mater, you should be able to see the subarachnoid space. This space is basically where major cerebral arteries can be found. Underneath these arteries is the pia mater, and then right underneath the pia mater is the brain tissue itself, the nerve cells of our brains. Well, these arteries over here can become dilated and end up having the so-called aneurysms. Aneurysm is basically a pathology in which an artery is too dilated, and these aneurysms can rupture. Once they rupture, it can cause bleeding in the subarachnoid space. These causes for headache, such as Epidural hematoma and subarachnoid bleeding are usually easy to recognize, and so is the intraparenchymal bleeding, which happens in the brain tissue itself. Now, intraparenchymal bleeding can sometimes be chronic, usually after an acute phase. But the real trick here is not to confuse subdural hematoma with headache such as migraine, tension headache, or cluster headache. Subdural hematoma can be chronic and slowly progress over a longer period of time. This bleeding can be caused by a trauma, but it's also associated with regular things such as old age or some long-term pathologies such as hypertension and alcohol overuse. So how can we avoid confusing these dangerous, lethal causes for headache with non-lethal types of headaches such as migraine and tension type of headache? I guess the easiest one to recognize would be the epidural hemorrhage, because there's trauma right before the symptoms start. The patients can then lose consciousness, get better and wake up, but that is followed by a massive headache attack. Now, subarachnoid bleeding is often recognized when patients describe the worst headache they ever experienced. It's often described as a thunderclap headache, or they simply feel as if they're having their head whipped with a whip. The intraparenchymal bleeding can often be recognized because the patients experience neurologic deficits. For example, if the area for speech is affected, then the patients might exhibit difficulty speaking. But the true trick here is to recognize subdural hematoma, because subdural hematoma can be chronic. It can come with subtle symptoms such as confusion, difficulty concentrating, and feeling tired. The true alarm sign here is when headache comes together with dizziness, and headache is becoming worse, progressively worse. That means that there's more and more blood accumulated in the subdural space, and it eventually exerts pressure on the brain tissue. Furthermore, these patients might experience seizures and loss of consciousness. Something that can truly help you learn about headache and dizziness and their causes are the differential diagnosis tables at Symptomsky.com, where you can compare these different conditions. But if you're a medical professional or a doctor and you want to make a similar video, then you can go to Anatomsky.com. Of course, both can subscribe to our channel